5 construction workers have been killed in a fire at a new COVID-19 vaccine production facility in India. The Serum Institute factory was being built to ramp up supply of the vaccines. The plant operator said the fire did not affect existing vaccine production or its stockpile. Well, India has begun vaccinating its population of 1.3 billion people. Frontline health workers are among the first to be offered the jab, but the rollout has been slow, with less than 60% of the target being met so far. The government says one reason is a mistrust of vaccines that's being fueled by misinformation on social media. Some people are also concerned that one of the vaccines was approved before Phase 3 trials were completed. DW's Marina Chaudhary has this report.
For 37-year-old Geeta Raj, it's a big day today. She is going to get her first dose of the COVID-19 vaccine. Geeta has been working as a nurse at a private hospital in Delhi for 3 years and has been a health worker for over 20 years now. As a health worker during the pandemic, she has been worried about the safety of her family against the virus. I had to take utmost care at home. There are little children in our family and I was concerned about their health. I had to stay in a separate room, keep my clothes and shoes separately, maintain proper hygiene, constantly use sanitizers. I had to take care of the smallest things. Geeta is one of the first in line in the country to receive the vaccine for the virus. India is in the middle of what is being called the world's largest COVID-19 immunization program. In the first round of the vaccine rollout, the government aims to vaccinate about 30 million health workers and other frontline workers. 2 vaccines so far have been given emergency use approval by the country's drug regulatory authority, the Oxford AstraZeneca jab called Covishield in India, and Covaxin, an indigenous vaccine developed by Bharat Biotech. But as the country takes a crucial step towards battling the pandemic, many concerns loom large. There are questions being raised on Covaxin getting approval from Indian authorities without its efficacy data in place, as its Phase 3 trials are still underway. Some experts say that this is a break from established protocol and could lead to an atmosphere of distrust among people. However, there is no clear consensus on this issue in the medical community. Dr. Virender S. Chauhan, a leading vaccinologist, says the approval to Covaxin has been given relying on the data of immunogenicity and safety. He says such emergency government approvals are not uncommon in unusual circumstances.
Vaccines are given to masses, and masses have to accept the vaccine. The only way to accept what you say, I say, is to communicate better and transparent. Communication then, communication in the middle, and communication now should not be confusing to people.
Even though there are anxious voices regarding the emergency approval, many working in the healthcare sector are confident that vaccination is the right step to take. This is a highly contagious disease, so it was important for the vaccination to start. Geeta is now almost through the mandatory 30-minute observation period post-vaccination. She says she has started feeling more secure against the coronavirus and is eagerly awaiting the second dose.
Well, for more on India's vaccination drive, I'm joined now by Malini Isola. She's a public health professional and works with the All India Drug Action Network. Thanks for being with us this morning, Ms. Isola. Now, the vaccination campaign has been underway for a week. What's your assessment of the rollout so far?
So I think we've been hearing reports of some hesitancy on the part of healthcare workers who are supposed to be vaccinated in this first phase. As we just heard from your ground report, one of the vaccines, which is Bharat Biotech's Covaxin, was approved without the efficacy data because those are still being collected in the Phase 3 trial that is underway. However, in granting the approval for this vaccine, the regulator had to impose certain safeguards, and it comes with a variety of conditions. So, for example, the use of the vaccine requires that informed consent is taken, that there is a close follow-up and monitoring of the volunteers post-vaccination, and also provision of medical management and compensation in case of any adverse events. It does seem that perhaps also because healthcare workers are a group that may have a higher level of medical literacy, it's possible that the absence of data on efficacy and the extra procedures that are being followed in this case might have caused some anxiety.
Okay, now many Indians, talking about anxiety, many Indians have distrust about their government to help them, especially when it comes to public health matters. How much of a role is disinformation, misinformation playing in this skepticism?
I think at the moment, in the current scenario, the government is doing a lot to try to issue communication to encourage healthcare workers to come and take the vaccine. However, that communication has had limitations. So, for example, the government is not in a position to vouch for the efficacy of either of the vaccines. So that's Serum Institute's vaccine because of the regimen under which it's being rolled out in India. We're not very clear on what efficacy estimates the approval was granted. And of course, Bharat Biotech's vaccine. So the focus has now shifted to saying that these vaccines are safe. However, the procedures for investigating any sorts of adverse events following immunization are not laid out very clearly, and that could also be a cause of damaging public confidence in the vaccines.
Okay. Can you tell me what your prediction is for the goal of reaching 300 million vaccinations by the second half of the year? Do you think that's realistic, briefly?
See, it's quite an ambitious plan that the government has embarked on. And of course, this has happened with a lot of preparation. India has some experience in mass vaccination, given that we have a vast routine immunization program.
Excuse me, is that a yes or a no? Just wondering.
I think we've just only started, and we haven't yet run into a lot of trouble, except, of course, the fact of lower uptake of the vaccines.
Okay.
So it's still yet to be seen how it goes.
Malini Aisola of the All India Drug Action Network in Delhi, thank you very much.